Has the RT ever told you not to touch their ventilator? These are the 4 settings that you need to understand before you can even consider touching the ventilator. First, we're hitting respiratory rate. Look, everyone knows the safe zone is 12 to 20 breaths per minute for normal people. But the real secret is that rate varies completely based on patient presentation. We use things like ABGs and their end title and their diagnosis to determine where their respiratory rate should be. The next setting is PEEP, or positive end expiratory pressure, and this is the pressure keeping those alveoli open after a patient breathes out. A standard PEEP is about 5 for you and I, but if your patient is super sick, like with severe pneumonia or ARDS, you may need to crank it up a little bit to achieve the oxygenation you need. We use PEEP to adjust SpO2 on the monitor. Be careful going up too high, you can cause severe injuries. Let's move on to the third setting, tidal volume. This is simply how much air goes in and out for every breath you take. And the rule here is that less is typically more. We use ideal body weight to calculate a setting and find a safe range for each patient individually. Tidal volume affects CO2 levels as well. Finally, we have FiO2, and this is the fraction of inspired oxygen. This is the easiest one to get a little bit lazy with because you want to run your patient with as little FiO2 as possible to maintain their oxygen saturation levels. You and I breathe about 21% oxygen, so we can artificially increase their FiO2 to deliver more oxygen to their body, thus increasing their SpO2. Too much can cause oxygen toxicity, so just be careful. So remember those 4 settings: rate, PEEP, volume, and FiO2. Get this right, and maybe the RT will let you start looking in the direction of their ventilator.